Healthcare. It's a topic that you hear daily and one that can be confusing at times. Since 2013, the number of Americans without health insurance has been cut in half. At the same time, though, the cost per person is expected to grow almost 5% between now and 2025. And when it comes to coverage plans, how do you know which is the right one to choose? What options are there? Well, recently I had a chance to sit down with Simeon Schindelman, CEO of Brighton Health Plan Solutions, and we're going to talk about their new product called Create that could really be a game changer for the industry. Take a look. So tell me a little bit about your background and how you got involved with the healthcare industry.
I became very interested in the healthcare elements of insurance because I became interested in the impact that healthcare has on people and the economic cost to the country of healthcare. And so it just became very interesting to me. And I moved from being kind of a more technical participant in the business to somebody who wanted to be involved in healthcare.
All right, let's talk about Create. That's why we're here. Create is your newest product. Why did you choose to launch Create?
The healthcare industry needs a platform that does align the interests of the various parties, that does bring market forces into play, that does, frankly, help determine winners and losers in the world of healthcare providers. Those who are most efficient and most beneficial for the people they treat should have the best success and see the most patients. Those who aren't as good shouldn't have that privilege. And so we built Create in order to solve some very specific problems. And Create is built on these three. One, establishing longer-term and closer doctor-patient relationships. Two, ensuring that the most efficient and most valuable and best performing providers are also the most successful. Three, introducing market forces that every day will make cost go down and quality go up. Those are the three principles of Create. What we're bringing, one of the fundamental elements that we bring is at open enrollment, we ask you to choose a specific healthcare system that you'll join. You don't have to, you can choose an open access product as well, but you'll save a lot of money and we think you'll get better healthcare if you choose a specific system. It's so important because very few people need significant healthcare today, but when they do, and we're all gonna need it, when we do, the doctors, the nurses, the other healthcare providers should know a lot about us at that moment. They should understand our health histories, our preferences, our family's histories and our family's ideas and our needs. So when we walk in a more serious situation, that long-term relationship has produced knowledge and understanding and data that goes two ways, and we can get the best healthcare. And choosing a specific healthcare system allows that. You'll be aligned more with a doctor and with certain specific specialists around that doctor if you need them. They'll know more about you. Frankly, you'll also be bringing more of your money to that doctor. And in some ways, we need to recognize that you're rewarding that healthcare system, that doctor, those nurses, those specialists, for the fact that you believe that they've demonstrated they're very good at what they do. That's the idea of rewarding those who are best. The idea of a single healthcare system also is part of the idea of a marketplace. So Create aligns directly with the three motivations. The idea of a single healthcare system is Create longer term, closer two-way relationships with doctors and hospitals, rewarding those who provide the best, highest value service. And third, competition. If I choose Mount Sinai and I don't choose somebody else when I enroll, Mount Sinai and its healthcare providers won and everybody else actually did not win. And we've actually just started to create competition on the supply side of healthcare. I don't think anybody's done that out here before. I've done something a lot like this once before. It was in 4 states in the upper Midwest. Very successful, lots of enrollment, much lower healthcare costs than in open access models. Very satisfied by many measures.
Given that, then why do you think it'll be as equally successful here?
We think it'll be equally successful here because there's also something going on in New York, New Jersey, Connecticut that has to be addressed, which is healthcare benefits are very expensive. This is among the most expensive cities in the country. That puts pressure on wages. It puts pressure on labor unions. It puts pressure on governments. That's simply enough. That means a new solution is necessary.